When you see this picture right there on your step 1 exam, you should automatically know the answer, no questions asked. This is probably the highest yield question you can get asked about tumor suppressor genes. And if you see that picture right there, you should get the answer without thinking twice. So let's get right into it. A child presents with bilateral retinal tumors, mutation of which gene is most likely responsible? So I'm going to go through this kind of quick. Let's start with APC gene. APC, if it's mutated, it's associated with colon cancer, specifically familial adenomatous polyposis. It is not associated with the eye thing going on with this child in this picture, so that's the wrong answer immediately. And as for B, we have the BRCA1 gene. Now, we all know the BRCA1 gene is associated with different types of breast tumors. We can see in the picture that there's something going on with the eye. Even the vignette says a retinal tumor. And this patient is a child, so there's no suspicion for a breast tumor. So B is automatically incorrect as well. C, P53, this is a broad gene that controls many different processes in the body, many different cell cycles. It's associated with a lot of cancers if it's mutated. It could be an answer, but it's very broad here. We're looking for something more specific. It's not P53. Maybe we keep it on the side and see if there's anything more specific for the retinal tumors we're seeing here. So what this vignette is describing is a bilateral retinoblastoma. The option D, RB, stands for retinoblastoma. This gene controls the G1 to S phase of the cell cycle. It is also associated with bilateral retinal tumors or retinoblastomas. Therefore, there is most likely a mutation in RB. D is the correct answer and is more specific than P53 or anything we've discussed so far. Last but not least, we have WT1, option E. This is a gene associated with Wilms tumor. So if it's mutated, you get Wilms tumor, which is a tumor of the kidney in a child. You get painless hematuria and many other manifestations. It does not fit in this vignette or in this answer. Therefore, it's the wrong answer. As I've discussed, this question is something you should note like this. You should see this on step 1. This should be a question that saves you time, not where you spend your time on. But yeah, thank you so much for watching this video. If you liked it, please follow our page and share it. Thanks.